day everyone, I am Maria Regine M. BRIONES, a member of Group 5, and my co-members are Genevieve CAMPOS, Mark Arison Casison, and Kimberly CABIGON. So for today, we're going to discuss about postpartum psychiatric disorder. So first of all, what is postpartum psychiatric disorder? This follows after childbirth. It is also known as postpartum, wherein mothers may experience postpartum disorders that may affect their mental health. The high hormonal changes and fluctuations that occur during and after childbirth could cause mothers to feel intense mood swings called the baby blues, which affects 80% of the mothers. If symptoms persist for more than a couple of weeks, then it could be potentially something more severe, such as a postpartum disorder. So now we're going to discuss about postpartum depression, also known as postnatal depression. It is a type of mood disorder that is associated after childbirth that may affect both sexes. Symptoms may include extreme sadness, low energy, anxiety, crying episodes, irritability, and changes in sleeping or eating patterns. Onset is typically between the first week and the first month following childbirth. PPD or postpartum depression may also negatively affect the newborn child. For the next slides, which is the causes and risk factors of postpartum depression, let's hear it from Mr. Casison.
If you have PPD, it's not because you did anything wrong. Expert thinks it happens for many reasons, and those can be different for different people. Some things that can raise the chances of postpartum depression includes the following. So first, a history of depression prior to becoming pregnant or during pregnancy. Age at time of pregnancy. The younger you are, the higher the chances. The ambivalence about the pregnancy, and we have also children. So the more you have, the more likely you are to be depressed in late pregnancy. We have the family history of mood disorder and going through an extremely stressful event like a job, loss of health crisis, having a child with special needs or health problems, having twins or triplets, having a history of depression or premenstrual dysphoric disorder or PMMD or PMDD, limited social support, living alone, and marital conflicts. So we have the symptoms of postpartum depression can be hard to detect. Many women have these symptoms following childbirth. We have trouble sleeping, appetite changes, severe fatigue, low libido, and frequent mood changes. And next is if with PPD, these come along with other symptoms of major depression, which are typical after childbirth and may include the following. So we have the being uninterested in your baby or feeling like you're not bonding with them, crying all the time, often for no reason, depressed mood, severe anger and crankiness, loss of pleasure, feelings of worthlessness, hopelessness, and helplessness, thoughts of death or suicide and hurting someone else, and also trouble concentrating or making decisions. So next is the symptoms of obsession compulsive disorder or OCD that are usually occur in the postpartum period, about 1% to 3% of women. The obsessions are usually related to concerns about the baby's health or relational fears of harming the baby. Panic disorder may also happen. You can have this condition and depression at the same time. Untreated postpartum depression can be dangerous for new moms and their children. A new mom should seek professional help when symptoms persist beyond 2 weeks. They can't function normally, they can't cope up with everyday situations, and they can have thoughts of harming themselves or their baby, and also they're feeling extremely anxious, scared, and panic most of the day. So next, we have here if there's no one cause of postpartum depression, but this Physical and emotional issues may contribute. These are the following: the hormones, lack of sleep and anxiety, and self-image. The hormones, the dramatic drop in estrogen and progesterone after you give birth may play a role. Other hormones produced by their thyroid gland also may drop sharply and make you feel tired, sluggish, and depressed. For lack of sleep, when you're sleep deprived and overwhelmed, you may have trouble handling even minor problems. For the anxiety, you may be anxious about your ability to take care for a newborn. And for the self-image, you may feel less attractive, struggle with your sense of identity, or feel that you've lost control over your life. The management of postpartum depression will be discussed by Ms. Campos.
Management of postpartum depression. Treatment and recovery time vary, depending on the severity of your depression and your individual needs. If you have an underactive thyroid or underlying illness, your doctor may treat those conditions or refer you to the appropriate specialist. Your doctor may also refer you to a mental health professional. Baby blues. The baby blues usually fade on their own within few days to 1 to 2 weeks after delivery. In the meantime, get as much rest as you can. Accept help from family and friends. Connect with other new moms. Create time to take care of yourself. And avoid alcohol and recreational drugs, which can make mood swings worse. Postpartum depression is often treated with psychotherapy. Psychotherapy may help through your concerns with psychiatrists, psychologists, or other mental health professionals. Through therapy, you can find better ways to cope with your feelings, solve problems, set realistic goals, and respond to situations in a positive way. Sometimes family or relationship therapy also helps. Antidepressants. Your doctor may recommend an antidepressant. Take note, if you are breastfeeding, any medication you will take will enter the breast milk. However, most antidepressants can be used during breastfeeding with a little risk of side effects for your baby. Work with your doctor to weigh the potential risks and benefits of specific antidepressants. Medications. Treatment may require a combination of medications, such as psychotic drugs, mood stabilizers, and benzodiazepines to control your signs and symptoms. Electroconvulsive therapy will be discussed by Ms. CABIGON.
So now, let's proceed to the next topic, which is electroconvulsive therapy or ECT. If your postpartum depression is severe and you experience postpartum psychosis, ECT may be recommended if symptoms do not respond to medication. ECT is a procedure in which small electrical currents are passed through the brain, intentionally triggering a brief seizure. ECT seems to cause changes in brain chemistry that can reduce the symptoms of psychosis and depression, especially when other treatments have been unsuccessful. Treatment for postpartum psychosis is challenge a mother's ability to breastfeed. Separation from the baby makes breastfeeding difficult, and some medications used to treat postpartum psychosis aren't recommended for women who are breastfeeding. If you are experiencing postpartum psychosis, your doctor can help you work through these challenges. So, in addition to professional treatment, you can do some things for yourself that build on your treatment plan and help speed recovery. So, these are the lifestyles and home remedies. First one is physical activity. Make healthy lifestyle choices. Include physical activities such as walk with your baby and other forms of exercise in your daily routine. Try to get adequate rest, eat healthy foods, and avoid alcohol. Next one is set realistic expectations. Don't pressure yourself to do everything. Scale back your expectations to the perfect household. Do what you can and leave your body to take rest. Next one is make time for yourself. Take some time for yourself and get out of the house. That may mean asking a partner to take care of the baby or arranging for a babysitter. do something you enjoy, such as a hobby or some form of entertainment. You might also schedule some time alone with your partner or friends. Next one is avoid isolation. Talk to your partner, family, and friends about how you are feeling. Ask other mothers about their experiences. Breaking the isolation may help you feel human again. Next one is ask for help. Try to open up for the person or people close to you and let them know you need help. If someone offers to babysit, take them up on it. If you can sleep, take a nap, or maybe you can catch a movie or meet for coffee with friends. You may also benefit from asking for help with parenting skills that can include caregiving techniques to improve your baby's sleep and stop fussing and crying. Remember, taking care of your baby includes taking care of yourself. So let's move on to coping and support. The already stressful, exhausting period following a baby's birth is more difficult when depression occurs. But remember, postpartum depression is never anyone's fault. It is a common medical condition that needs treatment. So, if you are having trouble coping with postpartum depression, talk with the therapist. Ask your doctor or therapist about local support groups for moms or women who have postpartum depression. Last one, preparing for your appointment. After your first appointment, your doctor may refer you to a mental health professional who can create the right treatment plan for you. You may want to find a trusted family member or a friend to join you for your appointment to help you remember all the information discussed. So that's all for the topic, and the summary will be discussed by Miss Briones.
So for the summary of our topic, postpartum depression has a significant adverse effect not only to the mother affected but also to her partner and the family as a whole. It is a great concern that follow-up studies of children whose mother experienced postpartum depression revealed a huge impact on the child's social-emotional development. It appears that these outcomes are driven by disturbances on the mother-child relationship, which begins in the early stage or early period of postpartum. This highlights the importance of early detection and treatment of postpartum depression by the primary healthcare team. It also suggests that efforts should be directed to the identification of high-risk samples and to the development and evaluation of preventive interventions.